We are doing case three. Case three is about Maria J., a pregnant young woman who injured herself at work, who arrived at the emergency room with concern for her child. After evaluation, Maria, sorry, I I messed up the name. Okay. After evaluation, Maria's pregnancy is concluded to be fine. However, due to a low-grade fever, she is instructed to take a COVID test. The local free prenatal clinic is unable to collect her prenatal information due to her lack of records. As it turns out, Maria J. is not her real identity. Her real identity is Maricela H. She is assuming her cousin's identity due to being an undocumented worker, also while assuming her cousin's work position. Her Rh factor is negative, resulting in the physician ordering Rogaine 300 mcg IM to prevent isoimmunization. However, due to Maricela's H continuously assuming Maria J's identity, confusion occurs among the blood bank due to Maria's past medical history contradicting Maricela's and the pharmacist adjusting her narcotic based on Maria's previous side effects to it. The electronic medical records, discharge instructions, and prescription are automatically printed under Maria J's name. Workers' compensation claims forms will also be completed for this medical evaluation. Maricela is then notified of her positive COVID results and decides to go against medical advice to self-isolate. The rest of the group will continue to answer ethical questions regarding this case.
So the first question asks, what is the scope of practice for each professional in this case? So the first is the free clinic that provides primary care for minor non-life-threatening illnesses and injuries to patients who are uninsured in underserved communities. There's the ED intake staff that asks patients about their information to confirm their identity with their medical records. The pharmacist dispenses prescription medications and counsels patients on safe and appropriate use of meds. The nursing team administers and monitors medications, also develops nursing care plans, takes care of vital signs, cares for wounds, performs basic life support. And the ED doctor makes decisions about managing the acute care for Maria's episode of vaginal spotting. The chaplain works with individuals, couples, families, and small groups, offering support and encouragement to people by providing crisis intervention, grief and bereavement counseling, and family support counseling. And finally, the Labor and Delivery Outpatient Center provides follow-up appointments to check up on Maria's progress after her ED discharge.
All right. So in terms of the interprofessional team engaging Maria, there's two aspects to consider. The first is Maria's education about what her COVID-19 positive test results means for her health and the health of her baby moving forward. Additionally, helping her, kind of think about what the possible adverse health outcomes related to assuming the identity of her cousin could be. And secondly, in terms of safety, what's going to happen to her and the baby when she goes back home? Is she going to be able to have proper continuity of care to ensure good long-term health for her and the baby moving forward? And then helping her think about the consequences of her decisions on her cousin's health when she reassumes her own identity moving forward as well. In terms of the responsibility of a healthcare provider reporting insurance fraud. So this can be done directly by contacting the Office of Inspector General, either via an online reporting form or by contacting a toll-free fraud hotline. And essentially, you can be given a tracking number to help kind of keep track with the case, and then they can help request additional information that can be kept confidential moving forward. And then secondly, the FBI is a primary agency that will keep tabs on this investigation, both for federal and private insurance programs. They have several partnerships through groups such as the Healthcare Fraud Prevention Partnership that kind of helps facilitate this process.
So my question was regarding the legal implications of Rogam and narcotic prescription in this case. So, with some research, kind of looked it up. RhoGAM is actually not a mandatory treatment. It's actually indicated for mothers who are Rh negative, and it's more of a preventative kind of treatment to stop any kind of antibodies that may form depending on someone's blood type, and then causing harm to the fetus. So in this case, Maricela is actually Rh negative, so RhoGAM would be medically indicated, but for Maria, whose identity she's assuming, she's Rh positive, and we can see the issues being caused in the blood bank. And then in terms of the narcotic prescription, again, we see that it becomes more of a case of falsifying medical record, because she's having all these prescriptions and all this being indicated and recorded as Maria, even though she's Maricela. And so in terms of the legal implications for both of these things, I kind of interpret it as falsifying medical records. And if we kind of look into what are the implications of that? I applied it to Texas since we're all in Texas as students. Falsifying medical exam reports, according to the Texas Penal Code, is actually an offense under the section of a felony of the third degree. And so if we look at the kind of implications of that, first-time offenders can be tried for a sentence of 2 to 10 years in prison and potentially a fine of $10,000. And in regard to that, also there's more of the civil lawsuits that can be filed in terms of malpractice and other kinds of loss of accreditation that can go with that.
For question 5, it asked information change to treatment plans and recommendations. For nursing, the nursing care plan would be altered due to the patient being COVID positive. The plan would be primarily education. The nurse's duty to the patient is to advocate, educate, and provide the best possible care. The nurse would transition to educating the patient regarding COVID-19 as a communicable disease, and that would include mode of transmission, resources for community clinics and free at-home testing kits, proper way to wear a mask or PPE, how to self-isolate, what social distancing measures actually are, and encourage any vaccination against COVID-19. If needed, the nurse would also provide an interpreter and discharge teaching in paper copies in Spanish if required. As a physician, the recommendation would be to go home and self-isolate and not to spread COVID-19 to the general public. And in accordance with CDC, you would self-isolate for 5 or more days, depending on your symptoms and results of any at-home self-tests. Pharmacology, the pharmacy would recommend any free or low-cost COVID-19 testing kits that they have available. And they would also want you to monitor and isolate. The pharmacy would also provide times and information regarding where to get vaccinated.
Okay, so the 6th question is asking what are the public health implications. We agreed that regarding the public health, it's more towards the COVID-19 positive. The patient does know she's positive. She agreed with the healthcare professionals that she'll isolate. But then the states in the story that she doesn't plan on isolating. She plans on going back to work. Going back to work puts her and her colleagues in danger regarding the easily transmissible COVID-19 virus. And she's putting everyone at work in danger with that.